and collaboration. So, like I said, on behalf of my entire committee, I here wish to formally welcome him to give the most recent update to the nation. Honorable Sir, with due respect, the floor is yours.
Thank you very much, Mr. Seri. As we are all aware of the current COVID-19 pandemic that has become a global challenge, nations all over the world have put forward strategies to deal with the problem. The situation has been overwhelming in a number of countries, with several people infected and with significant number of mortalities. In the Gambia, since onset of the outbreak in China, several steps have been taken with regards to our preparedness and response. These include sensitization, risk communication, and improved access to sanitary materials. Testing was done for 33 individuals in various categories. On the 17th March 2020, the Gambia registered her first case, who was a Gambian lady returning from the United Kingdom. She is still under treatment and quite stable. The second case was a Bangladeshi diabetic man who passed away en route to the hospital, and the test done posthumously showed to be positive. The third case was a Gambian man in his 70s who recently returned from France and was diagnosed on the 23rd March 2020. He is currently on admission and undergoing treatment. One of the close contacts of the second case, that's the late Bangladeshi man, who is on quarantine currently, was tested, and his test is inconclusive as we speak, and it is being repeated, and you will know as and when the test comes up. He's a Bangladeshi man who is said to be in his 40s, and he came to the Gambia with the second case who passed away. He is among the 10 close contacts tested yesterday, 24th March 2020. All others who were tested together with him were negative. The contact tracing is continuing aggressively. We request that anyone who has had contact with the Bangladeshi team or has visited the Markaz Center from the 17th to the 23rd March 2020, both dates inclusive, to call our toll-free number 1025 advice for necessary action to protect themselves, their families, and members of the community at large. Currently, we have 177 people on quarantine in various hotels, as they are all safe, and sound. In 6 days, the first batch will be out of quarantine if they continue to have no symptoms. 4 of our staff are amongst those being quarantined because of their possible exposure to the second case. We thank them for their immense hard work and sacrifice for the people of this country. We wish to tell them that our hearts and minds are with them, and we wish them all the best. We wish to thank all our health professionals and other supporting partners who are constantly sacrificing on the front lines for the control of this disease in the country. Our sincere appreciations also go to the security personnel who have also been going through the risk of supporting us. We urge all people living in the country to adhere strictly to the advice of the Ministry of Health and the government of the Gambia in the control of this disease. COVID-19 is not a joke, and we should all take it very, very seriously to make sure that it doesn't spread in the country. Once again, thank you very much for your attention. Our sincere gratitude also goes to the men and women of the media who are all the time with us. Come rain, come shine, they are there. patiently waiting to disseminate the information for the people of this country to be aware of what is happening and also to take much precautions. We equally advise the men and women of the media to also take the necessary precautions all the time, because that is also essential to protect all of yourselves. Once again, thank you very much.
Thank you very much, Honorable Minister, for that explicit statement. Perhaps we will now allow 2 or 3 questions, having known very well that he's quite a busy somebody. If there are possible questions that will be asked, you need to give your name and the media house that you represent, and you will be given the floor. Okay. Yes.
I'm Salif Wanja for GTTV, that's Standard Talents Promotion. Mr. Minister, a state health ministry that lacks a lab or research center to test COVID-19 cases instead of solely depending on private institutions like MRC, also jeopardizing that of all the citizens by setting up quarantine centers in dense populated areas like that of the one we have at Golden Beach. Perhaps we are having another one which we don't know exactly, which is probably existing in the midst of dense populated area too. Don't you think it is high time for you to actually tell the citizens of this country how serious is this government as far as COVID-19 is concerned?
Of course, you know the government is very serious as far as COVID-19 is concerned. You've seen all the steps that have been taken when this outbreak occurred in China. The sensitization, the press releases, the meetings, the mobilization, the discussions with the partners. In fact, I will tell you, and you should know that today, that Gambia's response has been more aggressive than a lot of countries in the sub-region since this outbreak started. Most of the things we started with, they started to do when they started having cases. So our response has been very, very aggressive, and this government takes the health of the people very seriously. You are talking about the lab. If you understand how these labs work, many of the countries have labs that are partnerships when it comes to infectious diseases. If you go to Senegal, they have the Pasteur Institute. That is not even purely government-owned from what the information we got, even from the name. It's a partnership lab. The MRC lab belongs to the MRC, but they have been doing a lot of collaboration with the government of the Gambia. In fact, the trainings are collective training. MRC and Gambia government collaborate to do a lot of work. By the way, MRC is in the Gambia, and they have facilities. So we interrelate and we use each other's facilities. MRC is in the Gambia. It is not in a foreign country. And it is in the Gambia to do what? To work for the Gambian people, not to work for any external partners. So we participate in using each other's resources. And some of the resources actually donated to the MRC are for the people of this country. But MRC's work here is for the people of this country, not for any other group. Now, the Gambia government has inherited a lab. The current government has inherited a lab. And that lab has recently been upgraded to what we call BL3. MRC's lab is a BL4. It talks about the biological safety levels. So the BL3 lab can equally do this test, and we are getting equipment, additional materials to be able to do the test in the Kotu lab, not just in the Kotu lab, in other centers in the country. But of course, you have known that even the people with the best of facilities are overwhelmed by this disease. So our steps are in the right direction, and we are building capacity. In fact, this is also an opportunity to build capacity across the length and breadth of this country. If you know what we are doing behind the scenes, we are procuring a lot of equipment for the health sector. All the major hospitals are going to be strengthened. All the major facilities, their labs are going to be strengthened. They are going to get a lot of diagnostic equipment. And we even want to decentralize the test so that tests are doable up-country. So when patients go up-country, they'll be tested rather than people moving from here over there. And people are being trained as to do those tests. Now, the Kotu lab will soon start functioning and doing the tests. We are working very hard on it. But you must know, in fact, there are still a lot of African countries who are unable to do these tests by themselves. So if you know the comparative facts, then it helps you very much to be able to relate to your current situation. Now, you talk about the quarantine. in various areas. You should also know, I don't know if you know, but if you didn't, we'll let you know today, that when we were having this first group of passengers who came into the country, unfortunately, we got the information just 2 hours before the arrival of the flight. But we thought it was very important. Our people swung into action. They swung into action, and then that was very late at night. We were all up, including myself as a minister, 2, 3 a.m. We were all up communicating and making sure that they get somewhere to stay. Now, but unfortunately, most of the hotels did not want to accommodate them for the fear of the disease. So the hotel we got was the only one that was ready to accommodate these people initially. So as time went by, other people came in. So this was a challenge. Now, but if people are quarantined, they are expected to be indoors. And if they are indoors, you have all known we are talking about social isolation, but it's for a distance. If people get 2 meters, that's good, apart. It could even be a little shorter than that. But we want it to be 2 meters. So if they are isolated in their rooms in the hotel, 2 meters, if that is in a densely populated area, I guess the densely populated area is much more than 2 meters away from this patient, isn't it? So the disease is not airborne, it's by droplets, so that distance is adequate.
Thank you very much, Honorable Minister. Do you have another person? If not, I allow him to give another. Okay, you come and then you come last, please, by virtue of time, or perhaps...
It's regarding exactly where he is right now.
Okay.
Because we are actually having escapees. A lot of the suspect, COVID-19 suspects. So that's the reason why I raised that question. The security of the citizenry. Because we understand that there isn't much security at those places. Because if there is, I'm sure there won't be any escapes.
Yeah, so we are equally concerned. In fact, people shouldn't have escaped in the first place. People should have been law-abiding. They should have done what they are supposed to do, because this is, this is what the law says. Under such circumstances, they should be quarantined. However, people being people, sometimes they do things that are not lawful. Now, the security is there, and I guess they are doing their best, but sometimes there are lapses here and there for these people. I don't know how they escaped, but thereafter, the security has been beefed up again, because really, naturally, you don't expect people to escape. It's not a prison. So you expect people to understand and abide by the rules. So if they decide to escape, we were all surprised that people will run away from such a thing and escape, because we thought they'll be very concerned about their own welfare, about the welfare of their loved ones. Sure. They wouldn't go into the homes where their loved ones are. So it came as a surprise to all of us, but security has been beefed up, and we keep on continuing, and we also want to urge the general public to be vigilant. Government cannot do it alone. People have to play a role. Each and every one of us has a very important role to play in this endeavor. Now, just today, someone called that someone they saw in their community came from outside, and they expected the person to be quarantined, and is in their community. So they alerted us. So this is community participation, and we welcome that, and we want all the citizens of this country to do so. If you have someone in your community that you expect to be in quarantine, please let us know. Just today we got that information, and our people have gone to get the person. So this is good. And the quarantine is very important, because you can see when the case happened at the Marcus Mosque, the people were quarantined, and one of them is being closely watched now, and we will get those test results confirmed, very soon, and we'll let the media know. So if that, assuming that individual were still in the community, it could have been dangerous. So that's why we insist on the quarantine. And by and large, I think a lot of them understand now, and they are all participating, because they also want their loved ones to be protected.
Thank you very much, Honorable Minister. Can we have you, and then you come to last, please.
My name is Usman Jada from Paradise TV. What response do you have to these rumors going around on social media that the third confirmed victim yesterday was claiming that he did not have the coronavirus? And what response do you have for this other rumor that there is a confirmed case at Brikama?
Starting with the first part of your question, well, you know, sometimes in disease presentation, people could have denial. That happens when sometimes people are diagnosed of diseases because they would have thought the disease is too far away. They would have thought, no, this disease is not for them. Even the shock of just being told they have a disease that everybody is now talking about, people do tend to have denial because there is no way he could have confirmed that he had the disease or not. The health professionals have the potential to do that, and which they did and confirmed he has the disease. So probably he's in the denial phase. With regards to the one you are talking about, Brikama, I'm not aware, and we'll let you know if you get any information to that. Yeah.
Thank you very much. Can we have Ma?
My name is...
Yeah, no, her hand was off well before her. Okay. If you don't mind.
No problem. No
Thank you.
problem.
Can you come up, please?
My name is Neso from Foreign Newspaper. Do you have a trained coronavirus medical team in each region? Do you have any ambulance in each region or border post to transport coronavirus suspect to medical facilities? Do you have protective gears to help officials at each border post or region?
Yes, so we have our team all over the country. You know, the health sector is such that we have regional teams. The Gambia is divided into 7 health regions. Each health region has a complete team, and each health region is headed by a regional director. So there is a team responsible for this, and they are working in very close collaboration with the central coordinating teams here. So there are people, public health officers are there, surveillance officers are there, epidemiology officers are there, and EPI officers are there, and so many other medical personnel are there. Now, with regards to the PPEs at each border post, yes, they all have PPEs, and we still have a lot of PPEs in stock, and a lot of PPEs are arriving into this country very, very soon. The Chinese embassy is donating some PPEs, WHO is donating, and then the Chinese philanthropist has also donated to the whole of Africa, and we are expecting those items here, including test kits, very soon in this country. Now, we have ambulances. We don't have ambulances at each border post. We have ambulances that can be called to go collect the people. However, we are working on procurement of ambulances during this our response phase, and the procurement process is ongoing. Inshallah, very soon we'll have a lot of ambulances plying these routes.
Thank you very much once again. Can we have the last person, please?
Yes, good afternoon. I am Aisha Ijalo from Gambian Talents TV. But I would like to ask my question in Wolof for the benefit of our audience and to the people that raised this question yesterday. We have one program called Lumadi Sibanjo that is done by Pa Usman Diouf in America. Deba Sibir Sobi, it was open line course. I'm not call a native of Bakau. Mu call when a guy then you don't play football. So you gis kubuga escape from the friendship hostel. The guy approach ko bunko lakte lu mo def mu ne dafa dem ci bitik bi then notice ne ki xamul place bi motax muy lakte bitik. So si bir conversation bi si la wane mom moy dafa bokkon ci ñu isolate from the Maracas, Bundun and stuff. So bu waxtane be ci bir mu ne dafa buga gina bunko lakte reason am muy gina mu ne mom dafa gom ne amul febar bi. Why guy push and pull with him, but they could not touch him, they could not hold him. And then, Buwahe Purmudelu, he used the other way around. God Bimuna, he is not certain. Definite description, Lugor Bisol, Wana Lukokunundru, and the age. So, Lunyo Latemoy, is the ministry aware of this? And if yes, what measures are you taking to cases like that? And the second one, also another caller, dafa call mu ne dafa dem in a private clinic. So in that clinic, they have the WHO questionnaire that is Nefo Jogi and stuff, where are you, whether you come from any country that is affected. So Bulate, a lady, she answered all yes. Boom answered everything yes. The lady herself believed she's already positive. And the clinic, what they have for her was, go back home, I'm not anywhere to get you here, and Carnifil is full, Banjul is full, and other public hospital as well. So Luma like them, do you have any relationship with other private clinics? And if yes, cases like that, how are you going to handle them? Yes,
Okay.
thank you.
Thank you.
Yeah. Okay. Mangla wax jërëjëf. Sa explanation bi def nga ko yëpp si wolof wante question bi yëpp si angale la ñëwee. So wante man dinaa try wax ko si wolof. Ku ngeen gisoon ku gaa gisoon si stadium bi yëguñ si dara man yëguma ko. Wante xëj na suma gaa yëg nañ ko wante suñ ko yëgee dinañ ko delloo foofu noonu. Wante loolu su dee am na lu mu ñëw woon rek mooy ñu beef of security foofu waate dinañ def loolu so suñ amee façon yooyu gars yi nuñ ko defee moo gën because suñ war ñoo dem si confrontation ak kooku wante mënoon nañoo call 1025 1025 mun nga koo call pour lu nekk si affaire yi COVID-19 mun nañ koo call suñ calloon loolu te loolu duñ si fay dara toll free number la suñ kooloon loolu rek ala suñ gaay nañ fa daw dem jëli ko wante foog naa façon lii laa doon waxoon si affaire yi information public bi suñ amee information rek na ko suñ gaay yegg suñ ko yegee rek nañ si am action système bi perfectut am nañ challenges wante for example kooku war naa xam ne warut a génna wante am na ñoo xam ne nag duñ dee faale yooyu suñ amee problème sax si lañ dee gënaali fin wante dinañ beef of security su dee loolu am na fàtte naa sa ñaareel question bi yeah yes ok so loolu tamit su dee hospital bi loolu la def correctut wante xam nga hospital yi tamit ay nit a fa nekk nekkul ne luñ dee def all the time si place yi def dee correctut waru ñoo def loolu dañ ko waroon a dimbale ñu ala team bi wante su dee loolu am na dinañ si wax ba pare suñ gaay ñu nekk si central level yi dañ dee liggéey ak ñu nekk si private clinic yi so ñoom yëpp a dee liggéey private clinic yi xam nañ lu ñu war a def wante it's a continuous process xëy na kuñ fa fekka xaw ma lu tax mu def loolu wante suñ munee am turi place bi dinañ dañ sensitise pour ñu defati loolu wante ku la wax loolu tamit su amee façon information boobu rek na call 1025 suñ gars yi dañ fa dee nekk 24 hours dinañ ko adresse dinañ yónni team boo xam ne dina follow up kooku nuñ ko déggee nii su dee mun nañ si am further information dinañ ko topp.
Thank you very much. We've almost come to the tail end of this press conference. We will now allow perhaps the Honourable Minister again. Perhaps you may wish to give a closing remark.
Thank you very much. Okay, she has another one.
To go the last one. Yes. Talking about the social distancing and information. Looking at the situation right now, I think the Ministry of Health and the Ministry of Information, we need to work hand in hand. But considering the risks involved, for instance, like the UK today, they have confirmed the Prince Charles to be positive. And right now, we are all in one place. So most of the time, the Ministry of Health will be like, this daily briefing is by 12. But throughout this week, we have been going there from 12 to this time. And don't you think you are putting the work of the information sector at frustration? And are you considering the risks involved? Right now, if you should look at our social distancing, I don't think this is the recommended one by the World Health. So what is your ministry doing to help the Ministry of Information or the people in the media as well?
Thank you very much. We apologize for the late start of your press conferences, but I think you can understand. These are unusual times. Unusual times, a whole lot of things happen. Things have to be approved. Actions have to be taken with the actual response. Information dissemination is important, but you have to also work to produce results. This is what we are doing. We have to get the logistics. She asked about the ambulances. Ambulances will not fly to come here. Someone has to conceptualize. Someone has to work on the logistics. Someone has to approve those things. Someone has to get contact with the ambulance people. Someone has to send them the resources. Someone has to arrange for the ambulances to get to the Gambia. And interestingly, it's the same team. Talking about the PPEs. So those administrative activities, especially under a lot of tension, we're all under a lot of tension. But this is the nature of the thing. We sleep very few hours each day. Sometimes we don't eat for 24 hours or more. So these are the challenges we are all facing. We know it's not easy for the media, but these are unusual times. So it is this is your part of the sacrifice. Our people are sacrificing a lot at our frontliners. Believe me, it's not easy. But this is your part of the sacrifice, and I'm happy you are at the front lines yourself all the time. All the time. So that's why I said you also will need to be given protective equipment, gloves when you need, they'll provide you with gloves and masks, because we want you to put on mask when it is necessary. That one, will be provided for you, because you are part and parcel of the entire team. Without the media, how can the message get to the people for them to know to even protect themselves? Someone has to get the message across to them. So your role is very, very important. Now, the social distancing is very important. I must tell you, I was, it's a little better here, but my suggestion before this press conference was you put the gadgets here in position and stay outside. So I'm surprised to meet all of you here, because that's what I said yesterday and that's what I said today. Put the gadgets here, I come alone here and say what I need to say, and then you get the recording, you come back to your machines. This is what I meant, so I don't know what happened with that messaging. But subsequently, I think you also have to learn to share information, right? The media houses need to collaborate. Well, understandably so, you all want to be at the same place at the same time. So these are the challenges. But if you devise a way that if it is the audio, one person takes for those people recording for radio, then one person takes for those recording for the TVs. That makes it easy, so you don't have to crowd. So you also have to devise ways of reducing the numbers, whilst not compromising on the information that you get. So these are all strategies that you also have to be innovative, and let us work on that, because the social distancing is very important, because we know diseases is transmitted from one person to the other. So if it doesn't have access to the second person, it's not likely the second person will get it. So that is why we emphasize on social distancing. And I'm happy you brought it forward. We all need to practice it in our homes, in our communities. And I think government is also coming up with strategies, because it also has implications. I mean, what about the vehicles? Where we sit in the vehicles, and then so on and so forth. But government is coming up with strategies to try to work on those things. But I want to use this opportunity to thank you again, but please send the message across to the people that COVID-19 is not a joke. The countries that have the worst scenarios now, unfortunately, we are a little relaxed about it. Not the governments, but the people themselves. They relaxed a little bit, and some were in denial. Some didn't. Some didn't appreciate the risk they were exposed to, and they continued with socialization. But a communicable disease of such, I repeat, if we distance from each other, then it can hardly leave one person to the other. So this is the strategy. And we urge all the citizens of this country and those who live in this country to follow the advice of the health personnel and to take all the recommendations from our various teams and take the pronouncements from the government very, very seriously. It is to protect ourselves, our families, and the whole nation. Thank you very much.
Thank you very much, Honorable Minister. That's brought us to the tail end. We'll be having this daily, so if you have some subsequent questions, perhaps you can keep them for the days to come.
Yeah.
I don't think I'll be doing justice if it happens to close without the Director of Communication giving a word. Okay, thank you for your understanding.
Yeah.
So, ladies and gentlemen, we've brought the curtain here. Thank you once again, and hope to see you tomorrow. Thank you.
Thank you very much.